So, somebody gets brought into A&E, and it's usually a son or daughter who's brought them in. And the sentence that comes out from the relative of the patient before we've even sat down properly very often is along the same lines. We think mom is getting dementia, or we think dad is getting dementia. He is forgetful, or she's exhausted, and they are just not themselves anymore. And in a small number of cases, what's actually going on is something that we can measure on a single tube of blood for roughly the price of a cup of coffee. A really, really cheap investigation. Now, that doesn't mean that every bit of low mood or fuzzy thinking after 50 comes down to a vitamin deficiency, because it doesn't. And depression and dementia are common conditions that deserve proper treatment in their own right. You know, some people who come to A&E with their relative, the answer might be dementia, but in most cases, it's something else. And it could be a vitamin deficiency that is causing this. And I say that because there is a group of B vitamin deficiencies that get missed over and over again in this age group, and they can produce symptoms that look almost identical to a lot of other things that concern people. So, there are 5 things that I want to go through with you in this video, and they all build on each other. So, it's really worth staying until the end because the last 2 points are where the practical stuff really sits. Hello to everybody watching this video. Thank you so much for watching wherever you're watching from. My name is Dr. Alex, and before I go any further, I want to let you know about my daily newsletter, almost like an add-on to this YouTube channel, which is something that I've started fairly recently. And I've really enjoyed writing and planning these different emails. And, I've written the first few already. They're all written when I'm having my morning coffee. It's completely free, by the way. It should arrive with you every single morning when you're having your breakfast or just as you've got to work. And it is always really short, maybe 30, 60, or, a couple of minutes long. And, it is basically either a habit or a tip or piece of research or something else that I've been thinking about or an experience, something that I think you will find really useful. Because if you're watching this video, by definition, really, you're somebody that is wanting to optimize their health and, get healthier and hopefully live longer as well. Well, I hope this email will really help you every single morning. So you can access that by going to dralexnewsletter.com or clicking on the link in the description or the pinned comment of this video. Let me know what you think. You can reply to the emails as well. Let me know what you think. And let me know if there's other things that you want me to focus on. So let's carry on with the rest of this video. So the first thing to talk about is what happens inside your stomach as you get older. It's a bit of an odd place to start, but it's completely relevant to what we're talking about here. Because your ability to pull vitamin B12 out of your food starts to fade from around your 50s onwards. So, the B12 that sits in a piece of fish or an egg isn't just loose and then ready to go. It is stuck onto proteins, and to release it, you need stomach acid along with an enzyme called pepsin, which is simply a protein that chops up other proteins. But once it's been freed, it still cannot get in on its own because your stomach lining, it makes a carrier protein called intrinsic factor. And the B12 has to be handed over to that carrier before it can be taken up right at the very end of your small intestine, your small bowel, which is called the terminal ileum. So, there are 2 steps there, and both of them depend on a stomach lining that is working properly. The thing is, though, as we age, that lining tends to get a bit thinner and a bit leakier as well, and acid production falls and intrinsic factor starts to fall along with it. So, the whole handover starts to fail. What B12 is doing in the meantime is helping to build something called myelin, which is the fatty insulation that wraps around your nerves, a bit like the plastic coating around an electrical wire, or the lagging around a pipe that you might use to plumb your bath or your sink in, something like that. When that insulation, that myelin sheath starts to thin, the signals through the nerves don't travel that cleanly. And that shows up as things like tiredness and low mood and irritability and poor concentration, but also things like pins and needles in the hands and the feet, but also things like a sore tongue, other strange things like this, like an unsteady walk. There are lots and lots of different symptoms associated with it. The next thing worth knowing about is actually your medication, because there are two very common prescriptions that actually reduce how much B12 you take in, and an enormous amount of people over the age of 50 are taking at least one of them. The first one is metformin, which is usually the first treatment that we offer for type 2 diabetes. And yes, it's obviously always better to rely on your diet and your exercise to keep your blood sugar in check, but some people really do need this drug, and on the whole, it is a fairly safe one that has been used for decades. It does, though, occasionally interfere with B12 absorption in the small intestine in your ileum, and the longer somebody's been taking it, the more likely that becomes. The second group is the acid-reducing medicines that we call PPI, so omeprazole or lansoprazole or pantoprazole, but also the older ones like famotidine as well. And you can probably work this one out for yourself from that last point that we mentioned, because if the very first step in getting B12 out of your food is stomach acid, then a tablet which is designed to reduce stomach acid is going to make that step harder. What makes this really worth raising is that heartburn or reflux medication is one of those things that people get started on for 6 weeks, but are still taking it 6 years later or 16 years later. We see this all the time, literally every single day. So the useful thing to do here isn't to stop your tablets, without telling anybody necessarily. It is to ask whether your B12 has actually ever been checked and whether the acid medication is actually still needed. That is a conversation to have with your doctor. Now, the third thing to talk about is something called homocysteine, which isn't a word that comes up often outside a lab report. We don't really talk about homocysteine that often. This is a substance that your cells produce all day long as almost like a leftover from building and recycling proteins in the body. Normally, it gets cleared away almost as fast as it appears, and the cleanup job is done by 3 B vitamins working together, which is folate, B12, and B6. So when any of those run a bit low, the homocysteine level in your blood starts creeping up. And higher levels have actually been linked for years now with faster shrinkage of the brain and poor memory scores in older people. Now, the trial that's really worth mentioning here, and the link is below if you want to read about it, it was a fairly small study that came from Oxford in the UK. They took 271 people who already had mild memory problems. They gave half of them a combination of folic acid and B12 and B6, and half of them a dummy tablets, which is what we call a placebo. And then it scanned everybody's brains at the start, and then again 2 years later to see how much shrinkage had actually happened. Now, the treated group's brains shrunk by around 30% more slowly, and the difference was much bigger in the people who had started out with the highest homocysteine. Now, that is an interesting finding, undeniably, but it comes with real limits because this was obviously a small study in people who already had memory trouble, and larger trials in the general population haven't really shown a clear benefit to things like thinking and memory. But look, I think the honest way to read all of this is that the goal was never to actually become deficient and then correct it with the tablets. The goal is to eat in a way that means the deficiency in these vitamins never develops in the first place. That is the whole point, because if you're eating food that leaves you short of folate and B12, that same food is also leaving you short of many, many other things at the same time. And no single supplement is going to fix that. So let's talk about food in a bit more detail then, and why food will always trump any sort of supplement that you could put, buy from Amazon or any link on some doctor's page. When you eat the entire whole food, you get so many other benefits with it. But for B12 specifically, we're looking at things like fish and shellfish and meat and eggs and dairy. And, like I mentioned before, we have sardines or mackerel a couple of times a week, usually straight out of the tin on some sourdough toast, and it takes about a minute to make, but it's so good for you. And for folate, you want to think of things like leafy greens like spinach and kale and cabbage, plus also beans and lentils and chickpeas and beetroot as well. And a bag of frozen spinach that you throw a couple of handfuls into whatever you're cooking is about the easiest way to get folate into your diet. And for vitamin B6, again, it's fish, but also poultry and potatoes and bananas and chickpeas again. So none of those foods are exotic. It's just about eating the whole natural foods and trying to stay away from the ultra-processed stuff that very often has a lot of this stuff stripped out of it. The big question for a lot of you, though, is where do supplements actually fit? Well, there are 3 situations where they may make a bit more sense. If you eat a vegetarian or a particularly vegan diet, then B12 is the one nutrient that you cannot get from plants in any real amount. So a fortified food, I guess, like some cereals contain these fortified vitamins in them as well. You can see that on the label, although there's many negatives to cereal, or a supplement, is probably the better option for you. But I would always get this prescribed by your doctor. If you're on the medication that we talked about, or you're older, and you're absorbing less, then food alone may not be enough, even when you're eating well. And if a blood test shows that you are actually deficient, then, this isn't time to reach for a supplement at Boots, which is a pharmacy in the UK. Or, buying it yourself. This is a moment where you need treating with medication properly, and sometimes that means injections rather than tablets. Like I said, what doesn't make sense here is taking a handful of capsules, supplement as insurance against a diet that isn't feeding you properly, because the capsules will never ever replace what is missing from your plate. Now, the last thing to mention in this video, and probably the most useful bit, is knowing exactly what to ask for, because you will get a lot further with a specific request than just, going in a bit blindly and seeing what the doctor comes in with. So, you want to ask for a full blood count, which is called a complete blood count in the US, and that can show you things like unusually large red blood cells, often the very first clue that B12 or folate is running low. And then, obviously, you want to test for B12 and folate themselves, and also a ferritin, which measures your iron stores and your thyroid function, and an HbA1c, which is your 3-month average of your blood sugar. And the reason that thyroid and sugar come together is because an underactive thyroid and a rising blood sugar can cause very similar symptoms and get missed just as easily. All of this, though, isn't completely clear-cut. One thing that's really worth knowing is that the standard B12 test is not perfect. So, if your result sits at the low end of normal, but the symptoms are still there, it's reasonable to ask whether an active B12 test or what we call a methylmalonic acid test is available where you are, because those give a much better picture of whether your body can actually use the B12 that is there. And like I said, please don't stop any prescribed medication just off the back of this video. And if you're taking antidepressants, then nothing here replaces those. And the reason I say that is because low mood can be caused by a B12. But don't just stop taking them if you think your cause is really B12. You want to have a doctor check you out and make these decisions with you alongside you. I hope all of that makes sense and that it was useful. And, if this has been going on for a while for you or you've got any concerns, then just go and book an appointment with your doctor. Write all of your questions down so you don't miss any of them out and you get everything covered and see how you get on. Let me know in the comments if there's anything else elaborate on in future videos or anything else, in terms of different topics that you want me to focus on in the future. Thank you so much for watching. Have a great day wherever you are in the world, and I'll see you next time.